Hello everyone, this is Dr. Guruprasad, Interventional Cardiologist and Electrophysiologist from Chennai. So let us discuss some facts about heart diseases, focusing on heart attacks and its complications, and being an electrophysiologist, how we are going to evaluate those patients and to treat them. Heart attack, what we call as myocardial infarction in medical terminology, is rapidly rising in India, more so the young age, starting from 20 years of age up to 40, which is the most productive age group in India. That means the youth population are suffering from these heart attacks because of highly increasing deadly DO diseases, that is diabetes and hypertension. Along with that, changing lifestyle, stress and lack of exercise and addictions are important reasons for rising trends of heart attacks in India, even up to the extent of taking lives. So after the heart attack, so there are cardiologists, so many you might have heard, so putting stents, doing interventions, bypass surgeries. But not everything is just putting a stent or bypass is a solution for the patient life, because heart attacks, especially if they are massive, if it is a massive infarct, after the infarction, whatever you do, so they may develop heart failure and arrhythmias. Especially, we might have heard sudden cardiac deaths even after putting stents and doing bypass surgeries. The important reason being the dead tissue after the infarction, usually that has the potential source of generating rapid heartbeats which are fatal, known as ventricular tachycardia and ventricular fibrillation. So let me throw some important updates on this prevention of sudden cardiac death and the role of imaging modalities, how this technology, especially the scans and nuclear images, are going to help us in identifying, treating the fatal rhythm diseases of the heart, especially ventricular tachycardia or ventricular fibrillation after the heart attack. They happen at the damaged site. So after the massive heart attack, which is similar to a major accident where some people die, some people survive. So neither the dead people nor people who totally are alive, they don't need any service or intervention. It is the people who have injured and suffering, crying for help, they need real attention. Same way, after the heart attack, some tissues are alive, some tissues are dead. Both of them, they do not require any treatment. But some tissues, because of lack of blood supply, they are still crying, and that cry is the result of this potential electrical disorder known as ventricular arrhythmia. So this is the injured tissue after the heart attack that is producing the fatal arrhythmias. Today, in this Cardiac Imaging and Clinical Cardiology conference, we have discussed how to improvise these patients. With the help of the imaging modalities starting from echocardiography, cardiac MRI, CT and nuclear imaging like PET scan, SPECT scan, we can identify those sick hearts which are producing these fatal arrhythmias, and we can afford curative modalities like ablation, radiofrequency ablation, that is eliminating the zone of those electrical short circuits. And sometimes once we know that the heart is in the stage of failure, and once we confirm with these amazing modalities that the real status of the heart, that it's a failed heart, and we can choose the therapeutic modalities like which patient is suitable for a pacemaker like CRT implants, and which patients are suitable for radiofrequency ablation, and which patients are really eligible for even cardiac transplantation. So today the technology has took leaps and bounds to the extent that the imaging modalities are not only helping in diagnosing the heart diseases, especially the arrhythmias and heart failure, they are also helping us in choosing the therapeutic modalities that is medical therapy versus interventional therapies like radiofrequency ablations and implanting devices like ICD or CRTD, and up to the extent of transplanting the heart. So we expect still a lot of progress in the field of cardiology, especially in the era of artificial intelligence. Whatever it is, being physicians taking care of the patient's lives, we have to use, though the technology is rampantly advancing, we are the people responsible for proper utilization of these techniques and the invasive therapies to deliver the best therapy to the individualized patient. Thank you very much.